Hi, I'm Teri. I'm here to tell you about the Bridge, the mobile app for burn patients, which is the first of its kind to be designed, an app to be designed to improve the outcomes of burn patients being relieved, discharged from regional burn centers. Oh, that was fast. I want to do a shout out for my collaborators and their students, as this project is a completely UT product, and it was built by all the students here at UT. The funding for this project, we are really fortunate. We were able to get funding from the Memorial Medical Center Foundation in Springfield, Illinois, UT Office of Research and Engagement, the College of Social Work, and UT Research Foundation. In 2017, 486,000 people were treated for burn injuries. Sadly, people living in poverty continue to be overrepresented within this population. Because many patients also live in underserved and rural areas, community-based health and mental health services are frequently unprepared for treatment needs of these survivors. Interestingly, more people have access to cell phones than sanitary living conditions. So it made sense to pair needed post-discharge burn support with a health-based mobile app that delivers information directly to participants' smartphones. Wounds are only partially healed when patients are discharged. Open wounds pose a risk for infection and will likely will require daily dressing changes until fully healed. Family members typically take primary responsibility for patient care once home, and community-based medical providers may have never seen a burn wound prior to that a patient. The Bridge is a mobile app platform which delivers our 90-day program to support the changing recovery needs of survivors discharged from regional burn centers. App content was developed using qualitative data from 3 stakeholder focus groups at Memorial Medical Center and SIU School of Medicine. Focus groups included burn nurses, plastic surgeons, and experienced burn survivors. The Bridge is password protected and HIPPA compliant, using an encrypted mainframe for personal information. The app was reviewed by the FDA and was found to be an educational device. Messages are designed to reflect anticipated recovery stage of biopsychosocial needs for app participants. The goal of the app is to decrease hospital readmissions and to increase quality of life and support individual and group resilience. The next step for the Bridge is a field test that will be conducted with adult members of the Phoenix Society for Burn Survivors. Once the kinks are worked out, the app will be piloted with adult patients at Firefighters Regional Burn Center on discharge. When daily messages are sent, when a daily message is sent, a push notification will be delivered to participants' smartphones asking them to log on to the app. But before advancing to the messages, participants will rate their pain, itch, anxiety, and mood, which will be tracked for the 90 days of the program. Participants can view their progress over time, and the data points will be stored and time and date stamped for future research. Positive cognitive, behavioral, and educational messages are sent directly to participants' smartphones to support optimal burn rehabilitation and psychosocial healing. The next slide actually reflects a message that will be sent to participants on day 2 of the 2nd week. We need to catch up. Here it is. So we tried to, the content is really based on what the nurses and the physicians and the burn survivors thought was important for people to know in that first 90 days after discharge. So despite pain associated with because proper wound care is so important to healing, videos depicting hand hygiene and dressing changes to support optimal burn rehabilitation, to support biopsychosocial healing. Proper wound care is so important. Okay, and the video library, included in the video library. Despite the pain associated with moving damaged tissue and affected joints, contractures will develop without extreme stretching of the burned areas. To support movement, videos depicting range of motion exercises for all zones of the body are included in the video library. There are also supportive web links available on the app, including the hospital which the patient was treated, the American Burn Association, Tennessee's Attorney General site for labor rights, suicide hotlines, Phoenix Society for Burn Survivors, and the Model Systems Knowledge Translation Center. The Phoenix Society and the MSKT also offered some of their content for the app. In addition to previously mentioned data, standardized scales will be used at the end of the program, including a satisfaction and demographic survey, the Connor-Davidson Resilience Scale, the Burn-Specific Health Scale, the CAGE-AIDS Screening and Substance Abuse Scale, and the GQ6 Gratitude Scale. There's a lot of room on the back end for growth. Following the Firefighters Center pilot, there is interest in a multi-site study with other burn centers and development of a U.S. Army Institute Surgical Research app for use with burned soldiers. If the app proves its efficacy, it may be useful for the World Health Organization because burn injuries continue to be a major public health challenge in developing countries.